My name is Dr. Paul Stanislaw and I'm a board-certified facial plastic surgeon. And in this video, I'll be discussing what to expect during the postoperative period following an otoplasty. Before getting into the postoperative period, I would like to go over a few things about otoplasties themselves. Otoplasties are amazing at improving a patient's self-confidence. It's hard to put into words how much an otoplasty can change a person's life. Patients with prominent ears or ears that stick out too far from their head have always hated their ears since childhood. When they were kids, other children would pick on them for their size of their ears, and as adults, they do everything they can to hide their ears by growing their hair long. When patients have an otoplasty and find out how easy an otoplasty is, they always regret not doing it sooner. So the purpose of this video is to give you a better understanding of how easy the postoperative period is after an otoplasty. In review, an otoplasty goes by different names, including ear pinning and ear reshaping. An otoplasty can be performed on one or both ears and is usually done in an office setting using local anesthetic. That means that numbing medication is injected around the ear, so a little bit behind the ear and a little bit in front of the ear. Prior to the otoplasty, there's a preoperative visit, and at that visit, you will get the pre-printed postoperative instructions, your prescriptions, and a bag filled with the supplies that you're going to need. And in that bag is going to be a bottle of hydrogen peroxide, a tube of either Neosporin or bacitracin or triple antibiotic ointment, and a container of cotton-tipped applicators or Q-tips. For the rest of this video, I'll be speaking as if both ears are operated upon, so we'll start with the day of the otoplasty, which is referred to as day 0. After having the otoplasty, a white gauze dressing will be placed around your head and neck to apply gentle pressure to your ears. This gentle pressure is applied to your ears to decrease the risk of blood collecting on the back side of the ear and to diminish the swelling and bruising. This dressing is kind of bulky and it can block your vision. If your vision is compromised, it isn't safe to drive a car, and for this reason, you need to have someone drive you home from the procedure. The numbing medication that was injected behind your ears will continue to keep your ears numb for 6 to 8 hours. When the numbing medication wears off, the gentle pressure from the dressing can make the ears ache for the first night. For this discomfort, you will be prescribed a medication called celecoxib, which is like ibuprofen. Celecoxib is not a narcotic, and this medication is taken twice a day as needed for discomfort. Over-the-counter Tylenol can be taken in between the doses of celecoxib for additional relief. The morning after the otoplasty, you can cut off the dressing at home with a pair of scissors. Your ears will immediately feel better once the dressing is removed. So, at home, that morning after the procedure, you're going to take just a pair of scissors that you have at home. They don't have to be sterile. And looking into a mirror, you're going to take your fingers and grab one layer at a time of the dressing. So there's multiple layers that go around and under your chin, and multiple layers of the dressing that goes over your forehead. So you grab the dressing and cut one layer at a time, grab, cut, grab, cut. You do the same thing for the dressing that goes over your temple here, over your forehead. You're going to cut it one layer at a time. What you're not going to do is take the scissors and try to cut the whole thing all at one time because it's too thick, it's not going to go, and you run the risk of cutting your hair or actually even cutting your skin. So remember, one layer at a time. For the first week, starting the night of the surgery, you will sleep with your head elevated above the level of your heart using a couple pillows or a recliner. Also, your activities will be limited to no bending, lifting, or straining, and this is to minimize the swelling. Bending over for a second to put your shoes on, it's not a big deal, but I don't want you to do anything prolonged head dependent where your head's hanging below the level of your heart. You will take an antibiotic for the week, and you'll start that. The first dose will be 1 hour prior to the procedure. After the dressing is removed, you can take a shower and wash your hair. Soap and water can run over your ears without a problem. While shampooing your hair, you will gently clean the area behind your ears with a cotton-tipped applicator. So while you're in the shower, you're going to bring some Q-tips in the shower, and you're going to take those Q-tips and just run them gently in the back while your hair is all shampooed, and run it in the back. And what you're doing is cleaning off the old ointment, and you're cleaning off any scabs or crusts that may have built up on the suture line. So showers are perfectly fine, but you can't take a bath, swim, or go into a hot tub for approximately 10 days after the surgery or 3 days after the sutures are removed. While the sutures are in place, you will clean off the old ointment with a cotton-tipped applicator soaked in hydrogen peroxide. And you're going to do that 3 times a day. So again, hydrogen peroxide, you're going to pour that in a cup. You're going to take your cotton-tipped applicators, soak it in the hydrogen peroxide, and just gently run it behind your ears in the crease to clean off the old ointment and clean off any scabs or crusts. Then you're going to take a dry Q-tip and run it through there just to dry the area. And when you've done that, you're going to take a little bit of that antibiotic ointment, put it on the Q-tip, and just run a little thin bead of antibiotic ointment on the backside on the sutures. What you're not doing is you're not pulling on your ear to look at it, and you're not using your fingers to apply any of these things to the back of your ear. So remember, you're going to do that all with a cotton tipped applicator so that you're not pulling on your ear. Now here are some photographs of a patient before having the otoplasty and 1 week after having the otoplasty. Between 7 and 10 days after the otoplasty, you'll return to the office for suture removal. The suture removal takes about 20 minutes and it doesn't hurt to have the sutures removed, so don't worry about that. Also, there's no problem with you driving yourself to this appointment. For the first month after the otoplasty, you can't pull in your ears to look at the back, so you can't pull in your ears like this, and you can't wear any tight-fitting shirts that might pull in your ears while dressing. Also, no helmets and no activities like wrestling or martial arts for the first month. At bedtime, you'll wear either a sweatband or a ski band over your ears. This band does not need to be tight, and its job is to prevent you from rolling over on an ear and accidentally pulling in the ear away from your head while sleeping. So here's an example just of a light band, okay? It doesn't have to be tight, and at bedtime for that first month, you're gonna apply this and you're gonna have this over your ears. And again, all this is to prevent you from rolling over your ear while sleeping and pulling the ear away from your scalp. Okay. Now, also, if you're going to wear a face mask due to COVID, these are KN95s. These are the ones that have the loops that go behind your ear. I don't want you using the loops behind your ear for the first month after the surgery. If you wear that face mask and you put it over your ear, that loop is going to put pressure on your incision, and over time it can erode through the incision and open up the incision and give you a wound. So for that first month, nothing like this. If you're going to wear a face mask that has the ear loops, you need to buy one of those extenders with the buttons on it that go behind your head, so that when you go to put this on, you loop it and put it over the button, and so that loop is not pulling on your incision. Even better, you can wear an N95 mask that have the loops that go behind your head. So again, if you're this would be preferred. You're going to wear a mask, and those loops go behind your head and they don't pull on your ears. Okay, so that's if you have to wear a mask for COVID reasons. Now, during the first 30 days after the procedure, the swelling that's on the back side of your ears will gradually diminish, and it's not unusual for the ears to be achy if you accidentally push on them, so that's true for the whole month. I will see you back and follow up at 1 month after the procedure, and all I'm doing is checking on the incisions. I'm making sure that the ears are nice and parallel to each other, and that they're about 15 to 17 millimeters from the scalp. We don't really want them plastered against the scalp, so they should be 15 to 17 millimeters from the scalp and nice and parallel to each other. Now here are some more photographs of a patient prior to the otoplasty, 1 week after the otoplasty, and 3 months after the otoplasty. As you can see, the swelling that was on the back side of the ears is completely resolved by 3 months. So again, you're going to come back at 1 week for the suture removal, 1 month for follow-up, and you're going to come back 3 months after the procedure for a follow-up examination. I hope this video gives you a better understanding of the postoperative period following an otoplasty. If you're interested in finding out more about otoplasties, you can go to my website at stanislawmd.com, or you can call the office at 860-409-1515.